Alright, so I'm going to be presenting the sulcus MDI. Now first I'm going to have my patient short sitting at the edge of the table. I'm going to have their back straight, and I'm going to have his arm hanging off the table. I'm going to palpate into the glenohumeral joint. I'm going to have my fingers on the epicondyles of his elbow and do a little tug. I'm looking for laxity, space within the joint, and if you can tell that they aren't relaxing, then you can put their hand right there in their lap and try again. It gets them to relax a little bit better, and give it a little pull again. And Reed has a little bit of clicking, so nothing too bad. And this is testing for multi-directional instability. The next test I'm going to be performing is the Fagan's MDI. This is also like the sulcus, testing for multi-directional instability. Now, with this one you want to have their arm abducted, and you want to have it on their shoulder, on your shoulder. When you do this, you want to have it directly parallel with the floor. If you're taller, you have to go into a deeper squat because you can't have their arm up this high. When you do this, you want to palpate for the head of the humerus, and then you want to push down, feeling for any movement and any instability that could occur. But this isn't an ideal test to use for multidirectional instability because your patient could freak out. So the next test I'm going to be doing is the anterior and posterior draw. So for this one, you're going to want them to be lying supine on the table. You're going to want to bring their arm out and secure it in between your armpit. You want to palpate for the head of the humerus and also push down so the scapula is on the table. And you want to just move the head of the humerus back and forth. Now when you move it anteriorly, that's testing for anterior instability, and posteriorly is checking for posterior instability. You'll be able to feel it while you do it because usually the head of the humerus would only move about 2 to 3 millimeters, but anything more than that, you could probably say that it's instability.
I'm testing using the apprehension test to test anterior instability, and you have their arm in 90 degrees abduction and their elbow flexed at 90, and you turn their arm into external rotation, and you're looking for them to wince or have any guarding, which will show instability. Reed's not showing anything there, which is good. And then along with that, you can do Job's relocation, and that's where you have your hand on the head of the humerus and you put them into external rotation, and that should feel better because you're pushing the head of the humerus into the glenoid fossa. There's also anterior release where you put them into all the way back into external rotation and you take your hand off, but that will hurt your patient, so that's not recommended. Next, I'm doing the load and shift anterior instability test. With this one, you have your forearm on the back of the scapula, and your arm around the head of the humerus, and you're going to take the head of the humerus with the other hand, compress it, and translate it anterior and posteriorly. They might have 2 to 3 millimeters of movement, but that's pretty unlikely unless they have a lot of instability. Next, I'm doing the Norwood or posterior glide test, testing for posterior instability. And with this, you're having the shoulder flexed and the elbow flexed, and you're palpating behind the shoulder, behind the glenoid fossa, and you're pushing down with your other hand. And with this, you'll feel a posterior, the head of the humerus move posteriorly into your hand, and that will show instability. I'm doing the jerk test, which is testing posterior instability. With this, it's like the Norwood, where you have the elbow flexed, but you're having them in full horizontal adduction. You're going to palpate the posterior side of the shoulder, and you're going to push down towards the shoulder. And with that, you're also looking for posterior translation of the head of the humerus.